This is Dr. Rajni Mandal with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is actinic keratosis. Actinic keratosis is a precancerous squamous proliferation due to chronic solar damage and immunosuppression. The DNA damage leads to p53 mutations and increased risk of squamous cell carcinoma. Here's a very common form of actinic keratosis. You can see here hyperkeratosis and parakeratosis. There is loss of the granular layer, and there is atypia and nuclear crowding of the basal layers of the epidermis. The atypia is characterized by enlarged nuclei with coarse chromatin and irregular nuclear contours. Sometimes you can even see mitotic activity. In this case, there is spongiosis due to these inflammatory cells, and sometimes you can even have acantholytic actinic keratoses, lichenoid actinic keratoses, as well as pigmented actinic keratoses. Actinic keratoses commonly spare the follicular infundibulum, as seen here. Sometimes, though, the follicular infundibulum is not spared, as seen in this case, with the basal keratinocytic atypia extending down the follicular infundibulum. It's present at the base of this biopsy, which signifies an increased risk of recurrence following biopsy. Another variant of actinic keratosis is the hypertrophic or hyperplastic variant. Here you can see marked thickening of the epidermis. In addition to that, you can see alternating orthokeratosis and parakeratosis. The orthokeratosis is the location of the follicular infundibula. This is also known as the flag sign. There is loss of the granular layer, and there is marked atypia of the basal layers of the epidermis. There is nuclear crowding, nuclear size is increased, as well as a coarse chromatin pattern. Sometimes you can have budding of the epidermis into the superficial layers of the dermis, which can resemble a superficial invasive squamous cell carcinoma. So here are your 5 flashbacks for today. Actinic keratosis is a precancerous squamous proliferation due to chronic solar damage and immunosuppression. The DNA damage leads to p53 mutations and an increased risk of squamous cell carcinoma. There's hyperkeratosis and atypia of epidermal keratinocytes in the lower layers, sparing a follicular infundibulum, and loss of granular layer. There are multiple variants, such as the acantholytic, lichenoid, and pigmented variants. There is the hypertrophic hyperplastic variants, which shows acanthosis with complex epidermal budding, orthokeratosis, and parakeratosis. This is known as a flag sign. Actinic keratoses can look similar to epidermal dysmaturation following chemotherapy or radiation, so clinical correlation is essential. That's it for me for today. This is Dr. Rajni Mandal from Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.